So just a brief slide on this modified New York criteria. This criteria has traditionally been used for the diagnosis of AS, the changes in the X-ray of the sacroiliac joints are graded according to this criteria for radiographic sacroiliitis based on the severity of involvement of both the sacroiliac joints on the X-ray. MRI is not used in this criteria. So this diagram shows inflammation in the joints in the vertebrae of the spine, the red areas over here, and the sacroiliac joints, which are eventually lead to bony fusion over these joints, as in this diagram. So axial spondyloarthritis actually includes both ankylosing spondylitis and non-radiographic axial spondyloarthritis. So as mentioned earlier, there's considerable overlap between patients who have predominant axial involvement and or those who have predominant peripheral involvement. And some may also have other associated conditions such as psoriasis and inflammatory bowel disease. So non-radiographic axial spondyloarthritis and ankylosing spondylitis are actually diseases on the spectrum of the same disease. At one end of the spectrum are people who on X-ray do not show any changes in the sacroiliac joint. So this is called as the non-radiographic stage or the pre-radiographic stage, where they may have back pain, they may have changes of sacroiliitis on the MRI, but on the X-rays, they do not show any definitive changes. And this is what is classified as non-radiographic axial spondyloarthritis. So MRI, which is a more sensitive test, may be needed to detect changes in the sacroiliac joints of these patients. So over time, some people in this non-radiographic axial spondyloarthritis category may develop signs of radiologic changes on the X-rays, like in the sacroiliac joints, which we classify as radiographic sacroiliitis if there are definite changes on the X-ray. So once the sacroiliac joints are clearly affected on X-ray, a person will be then classified to have ankylosing spondylitis. Some people may just present at presentation to the doctor may already have established ankylosing spondylitis. And then at the end of the spectrum over here, in some people with AS, the sacroiliac joints as well as the vertebrae may fuse into what doctors call a bamboo spine. However, there are many with non-radiographic axial spondyloarthritis who do not progress to ankylosing spondylitis. And similarly, there are also many with ankylosing spondylitis who do not advance to the severe advanced stage of bamboo spine. So in this diagram, again, the spectrum of axial spondyloarthritis is shown extending from early or mild disease on the side involving the sacroiliac joints through to more severe or late disease with erosive damage in the sacroiliac joints. This diagram is just meant to show the spectrum, but it doesn't imply that there's early or mild disease or late severe disease. It's just that there's a spectrum, and to just let us know that this concept exists. So just to highlight a little bit on what are erosions. So this is a knee joint. So in a normal joint, you would see that the bones and the joints, this is the joint and this is the bones, they are very irregular. But in erosions, this is what happens to the bone where it becomes disrupted. The irregular shape is changed and the bone doesn't have a smooth outline anymore. And then this again is the diagram which was showed earlier, where there's a fusion of the vertebra in the spine and the sacroiliac joints.